Did you know that more than 1 million sexually transmitted infection styes are acquired every day worldwide? That's right, every day, millions of people are exposed to bacteria, viruses, and parasites that can cause serious health problems, such as infertility, cancer, and even death. But what are styes? How are they spread? And how can you prevent and treat them? Welcome back to our channel. In this video, we will answer these questions and more, giving you a comprehensive overview of styes and how to protect your sexual health. What are styes? Styes are infections that are passed from one person to another through sexual contact. There are many different types of styes, but they can be broadly classified into 3 categories: bacterial, viral, and parasitic. Number 1. Bacterial styes. Bacterial styes are caused by bacteria that infect the genital or urinary tract, such as chlamydia, gonorrhea, and syphilis. Number 2. Viral styes. Viral styes are caused by viruses that infect the cells of the skin, mucous membranes, or blood, such as herpes, HPV, hepatitis B, and HIV. Number 3. Parasitic styes. Parasitic styes are caused by parasites that live on or in the genital or anal area, such as trichomoniases. Each stye has its own characteristics, symptoms, and complications, but some of them may share common features or overlap with each other. For example, chlamydia and gonorrhea often occur together and cause similar symptoms, such as painful urination, discharge, bleeding, and pelvic pain. Herpes and HPV can both cause blisters or warts in the genital or anal area, but herpes can also cause sores in and around the mouth. Syphilis and HIV can both affect the whole body and cause fever, rash, swollen glands, and weight loss, but syphilis can also cause painless sores and damage to the organs, while HIV can lead to AIDS and opportunistic infections. To give you a better idea of the common types of styes and their effects, let's take a look at different styes with their characteristics, symptoms, and complications of each stye. Number 1. Chlamydia. A bacterial stye manifests with symptoms such as painful urination, discharge, bleeding, and pelvic pain. Complications may include infertility, pelvic inflammatory disease, ectopic pregnancy, and an increased risk of HIV. Number 2. Gonorrhea. A bacterial stye presents similar symptoms to chlamydia, along with sore throat, anal itching, and joint pain. Complications may include disseminated gonococcal infection affecting the heart, joints, and skin, in addition to those associated with chlamydia. Number 3. Syphilis. It is also bacterial, may cause painless sores, rash, fever, swollen glands, headache, and fatigue. Complications may involve damage to the brain, heart, nerves, eyes, bones, and other organs, and an increased risk of HIV. Number 4. Herpes. A viral stye presents with blisters, ulcers, itching, burning, tingling, and flu-like symptoms. Recurrent outbreaks, an increased risk of HIV, and neonatal herpes are potential complications. Number 5. HPV. A viral stye can lead to warts and abnormal Pap tests. Complications include cervical, anal, penile, and other cancers, genital warts, and respiratory papillomatosis. Number 6. Hepatitis B. A viral stye may result in jaundice, dark urine, abdominal pain, nausea, vomiting, and fatigue. Complications include chronic liver disease, cirrhosis, liver cancer, and liver failure. Number 7. HIV. A viral stye may manifest with fever, rash, sore throat, swollen glands, weight loss, diarrhea, and night sweats. Complications include AIDS, opportunistic infections, cancers, and neurological disorders. Number 8. Trichomoniasis. A parasitic stye presents symptoms such as itching, burning, redness, discharge, odor, and pain. Complications may include preterm birth, low birth weight, and an increased risk of HIV. Styes can cause a variety of symptoms and complications, some of which can be very serious and life-threatening. However, many styes do not cause any symptoms or only mild symptoms that may be mistaken for other conditions, such as urinary tract infections or yeast infections. This means that many people who have styes may not know it and may unknowingly pass them on to their sexual partners. That is why it is very important to get tested regularly for styes, especially if you have multiple or new sexual partners or if you have been exposed to an stye. Getting tested is the only way to know for sure if you have an stye and to get the appropriate treatment. But how are styes transmitted in the first place? Styes can be transmitted through various ways depending on the type and location of the infection. The most common way is through sexual contact, which includes vaginal, oral, or anal sex. During sexual contact, the bacteria, viruses, or parasites that cause styes can enter the body through the mucous membranes of the genitals, mouth, or anus, or through small cuts or abrasions in the skin. Some styes, such as herpes and HPV, can also be transmitted through skin-to-skin contact, even without penetration or ejaculation. This means that you can get these styes from touching, kissing, or rubbing against the infected area of your partner. Another way that styes can be transmitted is through blood transfusions, needle sharing, or other exposure to infected blood or bodily fluids. This can happen when people inject drugs, share razors, toothbrushes, or piercing or tattoo equipment, or have accidents or injuries that involve blood. Some styes, such as hepatitis B and HIV, can be transmitted this way, and can also be passed from mother to child during pregnancy, childbirth, or breastfeeding. This can result in serious complications for the baby, such as birth defects, low birth weight, or infection. As you can see, there are many ways that styes can be transmitted, and some of them can be transmitted by more than one mode. This means that you can get or give an sty to anyone who has sexual or blood contact with you, regardless of their gender, age, or sexual orientation. It also means that you can get or give an sty even if you do not have any symptoms or if you use birth control methods, such as pills, patches, or implants. The only birth control method that can also prevent styes is the condom, which creates a barrier between the infected and uninfected areas. However, condoms are not 100% effective, and they can break, slip, or leak. Therefore, they should be used correctly and consistently, along with other prevention strategies to reduce the risk of styes. So, what are some of the prevention strategies that you can use to protect yourself and your sexual partners from styes? There are several ways that you can reduce your risk of getting or spreading styes, such as abstaining from sex or being in a mutually monogamous relationship with an uninfected partner. This is the most effective way to prevent styes, as it eliminates the possibility of exposure to the infection. However, this may not be feasible or desirable for everyone, and it requires trust and honesty between the partners. Using condoms or dental dams correctly and consistently during sex. This is the next best way to prevent styes, as it creates a barrier between the infected and uninfected areas. However, condoms and dental dams are not foolproof, and they can break, slip, or leak. Therefore, they should be used correctly and consistently, following the instructions on the package. They should also be used for every sexual act, including oral and anal sex, and they should be changed between partners or between different types of sex. They should also be used along with other prevention strategies, such as testing and treatment, to reduce the risk of styes. Getting vaccinated against hepatitis B and HPV. This is another way to prevent styes, as it stimulates the immune system to produce antibodies that can fight off the infection. However, vaccines are not available for all styes, and they may not protect against all strains of the infection. Therefore, they should be used as part of a comprehensive prevention strategy, which includes testing, treatment, and condom use. Vaccines are usually given in a series of shots, and they may have some side effects, such as pain, swelling, or fever. They are also not effective if you already have the infection, so you should get vaccinated before you become sexually active or as soon as possible after. Reducing the number of sexual partners. This is another way to prevent styes, as it lowers the chances of exposure to the infection. However, this may not be enough to prevent styes, as you can still get or give an sty from or to one partner, especially if they have other partners or if they have an undiagnosed or untreated infection. Therefore, you should also use condoms, get tested, and get treated, regardless of the number of partners you have. Avoiding sexual contact when under the influence of alcohol or drugs. This is another way to prevent styes, as it impairs your judgment and decision-making and makes you more likely to engage in risky behaviors, such as having unprotected sex, having sex with multiple or unknown partners, or having sex with someone who has an sty. Therefore, you should avoid or limit your alcohol or drug use, or seek help if you have a problem with substance abuse. Getting screened for styes regularly and informing sexual partners of the test results. This is another way to prevent styes, as it allows you to know your status and to get the appropriate treatment if you have an infection. Testing is simple, quick, and confidential, and it can be done at a clinic, a doctor's office, or even at home with a self-test kit. Depending on the type of test, you may need to provide a urine sample, a blood sample, a swab from the genital or anal area, or a saliva sample. You should get tested at least once a year, or more often if you have multiple or new partners, or if you have symptoms or exposure to STI. You should also inform your sexual partners of your test results and encourage them to get tested as well. This way, you can prevent spreading the infection to others or getting reinfected by your partner. If you test positive for STI, don't panic. Most STIs can be treated, and some can be cured. The sooner you get treated, the better your chances of avoiding complications and preventing transmission. Treatment options vary depending on the type and severity of the infection, but they usually involve taking medication, such as antibiotics, antivirals, or antiparasitics. Some medications are given as a single dose, while others are given as a course of several days or weeks. It is important to follow the instructions of your healthcare provider and to complete the prescribed treatment, even if your symptoms go away. You should also avoid sexual contact until the infection is cleared and until your partner is also treated. You may need to get tested again after the treatment to make sure the infection is gone. In this video, we have learned about the different types, transmission methods, symptoms, prevention strategies, and treatment options for STIs. STIs are very common and can have serious consequences for your health and well-being. The good news is that you can protect yourself and your sexual partners from STIs by following some simple steps. Know the facts, get tested, use protection, get vaccinated, and get treated. Remember, your sexual health is your responsibility. Take care of yourself and your partners, and don't be afraid to seek help if you need it. Thank you for watching this video. If you found it helpful, please like, comment, and share it with others. And don't forget to subscribe to our channel for more videos on sexual health and wellness.